10 signs your body's in trouble. Your body. You've only got the one, and it needs to last you your whole life. No pressure, huh? Your body has a way of telling you when it's happy, when it's sad, or when it desperately needs your attention. And there are certain signs that, if it's giving them to you, mean you'd better do some investigation. And you really won't expect some of these. If you notice any of these signs, they might indicate something is wrong. Next time you see your doctor, be sure to ask about it. Better to be safe than sorry, right? Number 1. Pink feet. Normally, your feet are pretty much the same color as your body, even if you use any of those handy skin creams to pamper yourself. Lotion may make your feet feel soft and comfortable, but it shouldn't change their color. Next time your feet are bare, take a look at them. Do they look really pink? Is the skin thin and wrinkled? Are they really hard and painful? If so, you might want to get a blood test to check your blood sugar levels. Discolored and distressed feet can indicate a metabolic problem, such as diabetes. Which doctor should you see? An endocrinologist will check your blood sugar and hormone levels. 2. Uncomfortable hugs. Who doesn't like hugs, right? But unless you're really into it, being tied up or crushed isn't much fun. Has someone ever hugged you and made you feel like you were being squeezed unusually tightly, tighter than they're actually trying to hug you? Or did it feel like they were tying you up around the waist, body, or legs with ropes and chains? If this happens to you, it might be a sign of a disease called multiple sclerosis, or MS. If you have unpleasant sensations in your arms and legs, like you're wearing invisible gloves or shoes, that can be a warning sign too. The feeling might just be irritating, or it could be very painful, but you should still pay attention to it. Which doctor should you see? A neurologist. Multiple sclerosis is a disease that affects your nerves. The sooner you catch it, the better. 3. Thinning eyebrows. Throughout history, thin eyebrows have been particularly fashionable in some cultures, while some people prefer big, bushy eyebrows. Plucking and styling your eyebrows can make a really bold fashion statement. But if you notice your eyebrows becoming naturally thinner without any help from your tweezers, you should see a doctor. This may be one of the symptoms of hypothyroidism, a condition that can lead to feelings of tiredness, constipation, depression, and weight gain. If you're pregnant, hypothyroidism can be especially dangerous, leading to developmental delays and potential birth defects. Which doctor should you see? An endocrinologist will test your thyroid hormone balance. Number 4. Swollen toes. We're back to the feet, which can really tell us a lot about our bodies. Take a look at your feet. If you have fat or swollen toes, or if your toes look like sausages, talk to your doctor. This symptom might signal psoriatic arthritis, which can result in damaged skin and pain. Which doctor should you see? A dermatologist and/or a rheumatologist can check for the condition and prescribe medication to treat the symptoms, getting you back on your feet in no time. Fun fact: toes may seem like an evolutionary leftover that we don't really need anymore, but it's unlikely they'll be going away anytime soon. Even your pinky toe helps keep your balance when you walk or run. The only way we'd lose our toes is if they actively threatened our survival. Evolution doesn't just shed inconvenient or useless things. If it did, no one would ever get appendicitis. Number 5. Loss of appetite. We've all got to eat, even when we're dieting. Trying to shed a few pounds? A diminished appetite can seem like a blessing, but it might be the opposite. If you experience a sudden loss of appetite and notice that you're also losing weight, it may be a symptom of a metabolic disorder. This may be genetic or the result of not getting proper nutrition over an extended period. If you also have acid reflux, this may be a sign of a gastroesophageal reflux disease, where stomach acid rises back up through your esophagus. That's the tube connecting your mouth and stomach, leading to pain and a pretty bad taste in your mouth. Yuck! Which doctor should you see? A gastroenterologist specializes in nutrition and the effects of food, or lack thereof, on your system. Going on a diet? Before and during a regimen of restricting the foods you eat, consult a licensed nutritionist and your doctor. Number 6. Itchy skin. We all itch sometimes, and it can feel so good to get in a good scratch. It may be one of the most satisfying sensations you'll ever experience. If, however, you have a persistently itchy skin that just won't let up, that could be a problem. In fact, it could be a sign of diabetes. Relax. Before you panic, consider some other explanations. Itchy spots are often caused by insect bites or mild allergic reactions to a new lotion or low-quality fabric. If none of these possibilities explain the itch, however, ask your doctor for an examination. Which doctor should you see? An endocrinologist can test your blood sugar levels to screen for diabetes. Did you know? Scratching an itch doesn't actually get rid of the itch. All it does is distract the brain from the itching sensation with a new feeling, the scratch. In fact, a 2014 study conducted by the Center for the Study of Itch at the Washington University School of Medicine in St. Louis showed that scratching released the hormone serotonin in the brain, actually enhancing the itching sensation. In mice, anyway. Number 7. You hate being inside. Maybe you just like the big outdoors, but if you're one of those people who always asks to open the windows in public transportation, you have trouble breathing indoors, or you feel claustrophobic at work without a window open, you should have your heart tested to exclude the risk of cardiac failure. Your thyroid might also need to be tested, because hypothyroidism can cause this kind of thing. If you feel stuffy all the time, you might be suffering from heat intolerance, where your body doesn't regulate heat properly. This can result from medication, excess caffeine use, thyroid problems, or some other condition like MS. Which doctor should you see? See a cardiologist first to test your heart, then follow up with an endocrinologist to check your thyroid. If neither of these turns up anything, consult your doctor to see if there might be some other cause. Number 8. You hate open windows. This is basically the opposite of intolerance of being indoors. If you can't stand open windows or you're cold even in the summer, you should get your thyroid checked. Your body might lack iodine, and this deficiency may lead to hypothyroidism. Cold intolerance can also result from anemia, lacking sufficient iron in your diet, fibromyalgia, or vasoconstriction. Which doctor should you see? An endocrinologist can test your thyroid. If that checks out, consult your primary care physician for other potential causes. Number 9. Sudden onset of kleptomania. Whoa there, Robin Hood! A sudden ignorance of the law and the wish to steal something small, even if you can easily pay for it, may be the first sign of dementia, especially if you've been a law-abiding citizen all your life. Unfortunately, dementia and other such conditions can be very subtle, and it can be hard to admit that there might be a problem, let alone ask for help. Watch yourself carefully and pay attention to your relatives, particularly the elderly. People with dementia might not even realize they have it, and they need our help to get it looked after. Which doctor should you see? Since the problem may be physical or psychological, consult with a range of behavioral experts. Make an appointment with a neurologist to check for signs of dementia, and see a therapist or psychiatrist to learn some cognitive behavioral techniques to deal with any sudden urges to steal things. If the doctors do identify the onset of dementia, follow their instructions to minimize its impact. Make sure you ask for help, even if you think you don't need it. Number 10. Changes in your nails. It's those feet again, warning us of impending trouble. But this time, your hands might help too. If you notice your nails changing shape, such as becoming thicker and wider, this may indicate that you have lung or heart problems. This condition, called nail clubbing, is not exactly a disease. It's a symptom of a pathological process in your body that can be caused by multiple diseases, mostly of the lungs or heart, but sometimes of the intestines, liver, or thyroid. Which doctor should you see? See a cardiologist for a full physical workup, and follow up with your primary care physician to identify other potential causes. Nail clubbing is definitely not normal and could signify some serious problems. Here's some bonus trivia. The Greek physician Hippocrates, who is often called the father of medicine, is frequently credited with being the first to identify and document nail clubbing as a sign of an underlying disease, which he did nearly 2,500 years ago. As such, the condition is sometimes referred to as Hippocratic fingers. We bet he's thrilled. Do you know of any other unusual changes in your body that suggest an underlying health condition? Tell us about it in the comments. And don't forget to like, share, and subscribe for more health tips from Brightside.